Welcome to Civil Discourse, a podcast where participants are free to share their ideas, empathize with other perspectives, and who intend to advance to a better solution to fix a societal ill. We will focus on topics that are particularly complicated. In a time where information is from sources more opinionated than ever, our mission is to find solutions and goals to accelerate the nation's progress with cultural impunity. I'm your host, Todd Furniss. Welcome to today's episode of Civil Discourse hosted by Todd Furniss. I'm delighted to have Scott Thompson here on the show today. Fantastic to have you, Scott. I'm really excited to learn a little bit more about what you're doing and what your firm is doing. I think it's interesting to see the innovations in the healthcare industry, and you're a part of that. So I want to dive into that. Before I get to that just yet, I want to tackle a few administrative details. For those of you out there who like the programming here, please like, share, and subscribe. One or all three are good. We appreciate your support and look forward to continuing the conversation. Scott, with that, let's dive right in. Tell me a little bit about how you got into what you're doing and a little bit about what your firm is all about.
Sure. So my background is in technology and management consulting, but for the last 22 years, I've been in healthcare startups. And most of that was in preventive medicine, corporate wellness, population health management programs. But my partners and I really saw an opportunity about 7 years ago in the genetic testing space because, as I said, I've been in preventive health for a long time. And what had happened in the last 10 years really was the cost of genetic testing just really plummeted. And so whereas, 10, 15 years ago, you were paying thousands of dollars for a genetic test, say, to find out if you have a certain cancer gene or, other hereditary diseases or risk for those diseases, now the genetic testing cost, or 7 years ago, is down into the hundreds of dollars and even less than that. So my partners and I saw the opportunity to use genetic testing for preventive purposes. And so what we did is said, let's use genetic testing for kind of the key focus areas that people in the prevention kind of space are really focused on. So what we did, we launched our first program, which was GxSlim, which is a weight loss program. And then every year since then, we've launched a major program. So GxRenew for healthy aging, GxPerform for athletic performance, GxNutrient for a micronutrient tendency panel, and then most recently GxCBD, which speaks to CBD metabolism and then reasons why you might use CBD. And I might mention, since we didn't already, the name of the company is Genetic Direction.
Well, thank you for that. So I want to just dive into a little bit more detail, if you can, on each of the tests, because I think it'd be helpful just to lay that out as a foundation for our subsequent discussion. So start with your offering around body composition, really. I don't know how to describe it. Really, a diet, weight loss, that kind of thing.
Yeah, so GxSlim is our weight loss program, and what we're doing is we're testing about just under 100 unique genetic markers that are tied to specific traits related to weight loss. So in the food section, we're looking at protein, fat, and carbohydrate utilization. And based on your genetic tendency to be, say, a poor fat utilizer or an enhanced protein utilizer, we will recommend a meal plan that is customized in that manner. So obviously, if you're a poor fat utilizer, we want less fat in your diet and so forth. Then we're looking at several traits in kind of the weight loss category, such as metabolism, satiety, your weight loss tendency. Some people are just genetically predisposed to not being able to lose weight as easily as others. And so, it often helps people to understand that, not just them, they're actually genetically predisposed. So, and then we're also looking at different types of exercise. So traits like fat loss response to cardio, body composition response to strength training, and so forth. And again, based on the outcomes, based on the genetic test results, we will recommend an exercise program that could be more beneficial for the individual. So, a common myth or misunderstanding is a lot of people think, well, if I'm going to lose weight, I need to do an hour of cardio every day. And that's just not the case for everyone. Everyone will definitely be in better cardiovascular health if they do an hour of cardio every day, but they may not be losing weight. For some people, they actually lose more weight and more body fat through strength training than through cardio. So we're based on those results, we are providing exercise and diet recommendations to help them that are customized to their genetic predisposition to help them achieve their weight loss goal.
So do you have any sort of longitudinal study that ties to the that you guys have done that ties the test results coupled with compliance to the program you recommended to the goals achieved?
We have not performed an internal study of our weight loss program, primarily because we're on version 4 now. We actually just launched another major release last December, in the fall of last year, and we just frankly haven't focused on that. We're constantly improving the program. I can tell you just from experience in talking to our affiliates, which are healthcare providers that are selling the programs to their clients, what they typically see if they follow the program is a weight loss of about 10 to 12 pounds per month. And it's not a 30 pounds in 30 days kind of thing, right? This is safe, progressive weight loss that is sustainable because you're following what your genetic predisposition tells you to do. So
you're learning how to eat the way your body was designed to consume food and process nutritional information.
And it's not a very low calorie diet, that are very popular, where you're eating less than 1,000 calories a day or even 600 calories a day. There's no, we're not prescribing any medication. It's really just eating in line with your genetic predisposition. And if you're exercising, doing the types of exercise that are going to be more effective for you.
So in essence, one of the things you're doing is you're busting the myth that says it's just all about calories in and calories out, which is, something that the broader industry seems not to either understand or embrace because they're promoting something different. And one of the things that I think is appealing about what you're doing is the fact that you're not wed to a particular business, service, or product that correlates to a finding. In other words, you're not you're not a personal fitness trainer selling personal fitness training sessions that can only be used with that personal trainer because that personal trainer is advocating, strength training, for example, as the be all end all. Similarly, you're not selling to a ultramarathon running coach who says that the only way to get there is through cardio. So that's, I think, a little bit helpful because it clarifies or eliminates any potential conflicts of interest. You're just saying, hey, from our research, this is the way you're built. In order to get the best results for your goal and achieve your goals, this is what you need to do based on the science that we have employed to develop these tests.
Right. Yeah, a lot of people ask us, well, what if I want to do the keto diet or, paleo or something like that? And say, keto works great for some people, but it doesn't work great for everyone, and frankly, a keto diet is pretty extreme in terms of, virtually no carbohydrates. I mean, the reality is everybody needs complex carbohydrates. So, but again, a low carb diet can work great for some people, but it won't for others. So if you're following your genetics, you're following your genetic predisposition, and you're just going to be more successful. And the example I use is, we hear the story of two women who are best friends, and they say, okay, we're going to diet together, we're going to exercise together, we're going to do absolutely everything together. One of them loses 15 pounds, the other one gains 5 pounds. And that's because of genetics. There is no, one program that works for all. So that's what we're, that's what we're proving every day.
And then I can imagine there are all sorts of allegations of cheating and wrongdoing
Right.
and personal relationships are frayed.
Right. Right.
So you made an interesting point there that you sell your products and services through other third parties,
Mhm.
healthcare professionals and the like.
Yep.
Do you have to be, in order to sell this, do you have to be a doctor or a nurse?
No, we sell primarily, we used to sell direct to consumer, we don't anymore. Frankly, just the customer acquisition cost was way too high. So, we very quickly started going through an affiliate channel. And so we have over 1,000 affiliates all over the US and Canada now. And it's really, it's integrative and functional medicine docs, dietitians, nutritionists, weight loss clinics, chiropractors, bariatric surgeons, personal trainers, you name it. And the answer is no, you don't have to have a certain licensure to sell our programs because we are classified by the FDA. Our programs are classified by the FDA as low risk general wellness device. And that is because it's non-invasive, just a cheek swab, it's not a blood draw. We're not diagnosing or treating disease. We're not prescribing medication, and we're not filing healthcare claims. So, so that's because we are classified by the FDA in that manner. You don't have to have a licensure to sell our program.
So we're staying on the topic of the healthcare. I mean the weight loss program. And I'm sorry, say the test again. The test name.
Weight loss is GxSlim.
GxSlim. Okay, we're staying on GxSlim for the moment. And are the large hospital systems affiliated with you? I mean, are they buying and reselling your product?
Not yet, and the main reason is because we're not reimbursable by Medicare, Medicaid, or insurance companies. So to get into the hospital networks and really, corporate wellness programs and things like that, you really need to be in network. And Medicare, Medicaid just isn't there yet on this kind of testing and program.
Which is a little, this kind of strikes me, and I don't know, I'd be pleasantly surprised if you actually read my book. But one of the things I point out is that oftentimes the business model gets in the way of healthcare.
Yeah.
And so because it's not covered by an insurance policy, you can't get access to it through your healthcare provider. Well, that doesn't make any walking around sense. So for example, let's imagine that I'm clinically diagnosed as obese. I should think that we would be clamoring to get GxSlim or a product like that, because that would enable us to solve our problem more rapidly and even potentially avert or avoid altogether bariatric surgery, which could be, an outcome, which it's not anybody's desire to have that service, but for that surgery. But that just doesn't make sense to me. Why haven't the healthcare systems embraced this aside from, or is it just a pure dollars and cents issue?
I don't think it's dollars and cents. I think it's too new. It's not been, thoroughly tested and vetted, and, so, kind of to your question earlier about us, doing a longitudinal study and all that, frankly, we just haven't focused on that. But those kinds of things need to be done many times over for, Medicare, Medicaid to say, okay, this is legitimate, it actually works, and it's worth, us reimbursing.
So your choice is either go through the expense of doing the longitudinal study or sell it alternatively through other distribution models, which is what you've elected to do. Perhaps, and hopefully you'll get a chance to do the longitudinal study otherwise. Let me ask you this, though. What I've observed is that products like this frequently find greater footing in single payer markets. So where you've got single payer systems really focused on resource allocation, and they're saying, hey, look, I can get this product into the hands of one of our residents that are covered by one of our citizens that are covered by the single payer system that we employ here in this country, whether it's Belgium or Holland or England or Canada, name that tune, Mexico. Then it makes sense for them to be a provider of the service, because at the end of the day, they only have so many euros or dollars or pesos to go around, and therefore they have to be very, very thoughtful about how they allocate it. And it seems to me that this would be something that would be preventative in nature, as you described it earlier, and thus allow the end user to take the test, follow the program, and avoid the need for other procedures. Because as we know, especially when you get overweight, it's not just the problem with carrying around a few extra pounds and maybe having to buy a new pair of trousers or a new dress. Instead, what it is, it's the adverse effect on your joints, your organs, your cardiopulmonary system, et cetera. And therefore you're largely at risk. In fact, just as not to make this too contemporary, but one of the problems we have right now is that something on the order of over 80%, I think the last number is 87% that I quoted in one of my interviews, of the people who died from COVID were clinically obese. So again, I would think that your product should soar in consumption, if not value, so that people get a hold of it and take the right steps to prevent any kind of an outcome like that. Have you tried foreign markets as an entry point?
We do have dozens of affiliates in other markets in Europe, Mexico. I mentioned Canada. We have quite a few in Canada, but then Latin America, even the Middle East. The challenges there are, we have two primary labs that we use for the genetic testing. They're both in the United States. So, you've got the additional international shipping cost of getting those the kits to the client, and then the sample back to the US. So that can be cost prohibitive, especially if it's on the other side of the world. The other issue is, one of the I would say most impactful pieces of our GxSlim program is our meal plan. And obviously, foods in other parts of the world are very different than what we have in America. So, obviously, if the demand is there in a specific country, then we will go down that road of customizing our meal plan for, local or regional foods. We just haven't done that yet because we haven't seen the demand as great. And really what we've seen in other countries, the affiliates that we have in these other countries, they are selling to the affluent. So it's not the folks that are using the public healthcare system, even though that's where probably most of the benefit could be experienced. It's really, as I said, because of the additional cost for shipping, international shipping for the samples and kits, they're really marketing to the affluent there who can afford, to pay for it.
Yeah, and most people don't realize this, but when you have a single payer system around the world, in almost every market around the world, I should say, about 30% of that market buys private insurance, which means that that's the percent of the population which is likely be correlated to the purchasing of your products and services only because that's the same demo. And so that's the correlation and not in private insurance necessarily. But it would seem to me that there would be an opportunity both for the healthcare systems in those single payer systems to acquire your products and services, but also it would be an opportunity for the local service provider to add value by doing the customization work for you on the healthcare plan for that individual. I mean, on the meal plan for that individual, because they can look at, would think that they could look at your test results and say, hey, if you do X, Y, and Z based on our foods and you follow this meal plan, then you're going to have better results. And that can be tailored, I would think, by the local healthcare professional.
Yeah, absolutely. And I know they're doing that in their own ways. We just have not, we've not systematized it in our product. So, the providers that are selling these programs internationally, I think are they're kind of doing that themselves and providing that kind of consultation. I will mention in the US, individuals can use their HSA or FSA dollars to pay for the test. So that helps a little bit. At least it's pre-tax money when they're doing that. But we have not been able to crack the nut yet on being an actual in-network covered product.
So let's just go down the path one more step. If I wanted to buy the product, how would I find a service provider or an affiliate of yours to go do that?
Mhm. So we, on our website, if you are looking to purchase, you're not going to be able to buy it on our website, but we basically have a form there that says if you're interested, it sends us an email and then we refer you to one of our practitioners.
Got it.
Yeah.
Okay, so we don't want to get heavy. We want our clothes to fit. We want to look good. The other thing we don't want to do is we don't want to get old and broken down. So you have another product that deals with aging.
Mhm.
How is that different from the first product we just discussed?
Yeah, so GxRenew is very different. It's much more of a kind of an overall health and wellness test and report. So, and we break the traits down in that program into 3 categories: look, feel, and function. So look would include, there's several skin traits, so things like skin aging, skin glycation, things like that. In the feel category, there are traits around sleep, around motivation to exercise, things like that. And then in the function category, there are traits like systemic inflammation, longevity, and there's also a number of mineral tendencies that are important for organ and bone health. So it's, we call it GxRenew, we call it a healthy aging program, but it's really more kind of an overall health and wellness product. So we have, it's interesting. When we do a genetic test, we will test for all genetic markers that we require across all of our programs every time. So we only have to do one genetic test. It's just, is the client or the patient paying for one report or two, or, and so how many interpretations are we doing, based on the number of reports they require or that they want. So our pricing actually drastically drops for the subsequent program, basically in half for a second program and half of that for the third program, because we're not doing another DNA test, we're doing another interpretation. So what often happens is a client will come and say, okay, I need to lose weight, let's do GxSlim. They lose weight, they love it, they want to learn more, they come back 6 months later and they want GxRenew because they want to understand more about their health and how their genetic predisposition how they can improve their lifestyle and their overall health and well-being by understanding their genetic predisposition and taking action on that. And so all of the traits across all of our programs, which collectively across all of our programs, we have about 75 unique traits. Every trait is looking at a different set of genetic markers. Every trait the science behind it is based on unique research. And this research is all, peer-reviewed, published in well-known medical journals, and so we are providing those recommendations to, again, let somebody, and every trait has success strategies. So how can you change your diet, your exercise, your lifestyle, your environment to basically take advantage of your genetic predisposition?
So, and then that makes sense. So then you have another product that's called Peak Performance. This is for training. So we don't want to be heavy. We don't want to get old too fast. And we want to do our avocations very well, like, play tennis or golf or swim or hike or cycle or whatever. And this test would tell us what we're going to be optimally designed for. Is that correct?
Yeah, so it's looking at traits. So GxPerform is our athletic performance program, and it's looking at traits like whether you are predisposed to being more of a power athlete versus endurance. It's looking at traits like injury risk. It's looking at H2O max. Basically how your body performs and responds to certain types of exercise. The other thing we're looking at is the same 3 macronutrient utilization traits that are in the weight loss program, protein, fat, and carb utilization. They're also in the performance program, but the content and the feedback and the recommendations are totally different. for somebody that is trying to be the best athlete they can be versus somebody trying to lose weight. So if you took both tests, you would have the same outcome, maybe poor fat utilizer, enhanced protein utilizer, but the recommendations are very different, right? For losing weight versus being an athlete. So what we have a lot of times with our personal trainers and we have gyms that are also affiliates, they will recommend to their athletes the GxPerform program plus GxNutrient. GxNutrient is, a comprehensive panel of vitamins and minerals that have definitive genetic predisposition. So, and to be clear, it's not a blood test. So we're not telling you how much, your levels of a certain micronutrient in your blood. We're telling you what your genetic predisposition is to having normal or below average amounts of that nutrient in your body, given a healthy diet. And again, the research behind each of those traits is unique. So in some cases, it's how much your body is absorbing of the nutrient, based on your diet. Some of it is how it's basically a transformation of, one substance into that nutrient. So they're all different and unique. But what's interesting is athletes they're very focused on fuel, right? And so they want to know all of the kind of the exercise and macronutrient information that's in GxPerform, but they also want to understand on the micronutrient level where they should potentially be supplementing or at least eating more foods that are rich in those nutrients that they're likely low in. So yeah, that's what we see a lot with our athletes.
So this helps illuminate some of my own personal experiences. I was a college tennis player and built completely differently at that time, as you might imagine. My foot speed was a lot different, but I had no real upper body strength at all because it wasn't necessary for the sport. It's all about timing and rotation and stuff, body weight transfer. And now, while I might be a lot stronger, I don't think I have the endurance. I certainly couldn't run a 5-minute 30-mile like I once did.
Wow, that's fast.
Emphasis on I did it once.
Right.
I thought I was going to die, but in any event, and I think that the foods that I consume are largely different for a whole bunch of reasons. And what we've seen is an evolution in diet over time, where the popular diets, the popularized diets, have become wildly different. So back in those days, it was all about the Haas diet. It was made famous by Martina Navratilova and others. And then we fast forward, we're all the way at the other end of this extreme. Haas typically tend to be high carb, low protein, low fat, no sugar, no salt. Whereas now keto and paleo are largely at the other end of that spectrum. So what you've done is you've helped illuminate why these things are the way they are and why our bodies react, or the basis for why our bodies react in different ways. And it's a little bit unsurprising, I guess, based on the many conversations we've had on this podcast as to why your products aren't sold more frequently and directly, because of the business models that get in the way. So going through affiliates makes sense. And this is the kind of stuff that's really frustrating, because this is designed for optimal health, for good health. And yet at the same time, the business models are supposed to be designed to accommodate good health and best health, actually don't. What they do is they are designed to avoid financial calamity, perhaps, if not create a financial calamity, but they certainly are more designed to fixing people who are already broken, meaning you're already overweight, you're already got an orthopedic problem, you've already got a liver problem, you've already got any number of other issues, and the healthcare system is designed to solve that as opposed to getting ahead of it. Another thing I point out in the book is that we really want to put more emphasis on preventative care. So I'm really excited about the idea that you can use your FSA and HSA dollars to purchase the product through an affiliate. Give us a sense of what the product costs. Like, let's say I go to my care provider who happens to be an affiliate. What is the likely cost of the product going to be?
Yeah, it's, our affiliates can charge what they want. typically what they'll do is they will package one of our tests with a service that they provide. So if it's a dietitian, they'll typically say, you can get this, GxSlim genetics-based weight loss program, and we will, once you get the report, we'll provide you with a 45-minute nutrition counseling session that basically takes into account these recommendations. And they'll charge typically between $300 and $400 for that. If they're just selling the test by itself, typically $250 to $300. So it really depends on the market and kind of how they're packaging things. But now, we do have some partnerships where we've created more kind of a custom program, and it's more mass sold without consultations. The price for that can get down, under $200, and in some, unique cases less than that. But a typical range, especially if you're going through a provider, is generally going to be between $250 and $400.
Very good.
And so that's one thing I was going to mention, when you're talking about, really, this is all kind of, we're very much a part of the movement for personalized medicine, right? And personalized preventive medicine specifically. And so, what we, talking about weight loss specifically, we never say that, this is a magic bullet and this is the only thing. It's a tool in the toolbox of a quality practitioner who wants to really truly personalize not necessarily a treatment plan, but a weight loss plan based on a number of factors. So we have several partners, medically supervised weight loss clinics, who are doing a full battery of blood tests, food allergy tests, genetic tests, and providing that truly personalized program for the individual. And it's very effective, but it's not cheap, right? So when you're running all of those tests, it can get expensive. So I think right now cost can be a barrier. It's not, and that's, like I said, when we started, trying to sell direct to consumer 7 years ago, it was just, our retail price then was $3.99, and it was just, nobody had heard of genetic direction. And even back then, people thought, is this even real? Like, how can you do genetics for weight loss? And so, I'd say a lot more people are aware of it today, but I would still say the majority of Americans don't even know that something like this exists. Not just genetic direction. I'm just saying using genetics to provide customized recommendations for weight loss or athletic performance and things like that. So there's still a long way to go just in terms of the education of the general population and the ability to do this, to buy these programs.
So how would you compare yourselves to like 23andMe or, one of the other organizations out there doing some form of genetic testing or another?
Mm-hmm. Yeah, so 23andMe is the largest and one of the oldest direct-to-consumer genetic testing companies. They are, and they've paved the way a lot for companies like ours. So I very much appreciate 23andMe. But basically what they do, they have two products. They have an ancestry product, which we don't do anything with ancestry. And then they have a health product. And that health product it's interesting. They do have a lot of disease markers, which are, very useful, whether you have the Alzheimer's gene or things like that. And they have a number of health traits. What I would say is, that they also have a lot of traits like eye color and hair color and freckles and things like that. That's more just kind of entertainment. In terms of the health traits, they can provide some information, but really there's a couple of major differences between us and them. Number one, we're much more prescriptive. So based on the results from all of your tests, if, again, you're buying a weight loss program. With 23andMe, you're buying an overall kind of health. They don't know if you're trying to lose weight. They don't know what you're trying to do. They just want to give you a bunch of information. We really focus on the purpose. So whether it's weight loss through GxSlim or athletic performance through GxPerform, we're much more prescriptive with things like a meal plan and exercise plan. Another major difference is, and I'm not sure if you're aware of this, but 23andMe's primary business plan is not to sell genetic tests. It's to sell the genetic data on the back end to pharmaceutical companies to develop drugs. So that's their primary revenue source, not the genetic test. So we never do that. We never sell, lend, or do anything with our clients' data other than deliver their reports. But one good thing that comes from 23andMe doing that is that if a client or a patient of ours has already done a 23andMe test, we can actually use their raw genetic data from 23andMe to generate our reports. So, 23andMe is testing about 800,000 genetic markers. We need about 300 for all of our tests. So, our 300 are a subset of their 800,000. And so when we have a customer who's already done 23andMe or Ancestry DNA, then we can take that raw genetic data and generate our reports. And it's basically half price because we're not having to do the genetic test. So, so 23andMe, I recommend it, especially for Ancestry and all the disease markers and things like that. But in terms of, a focused program for weight loss or athletic performance, that's not what they do.
Right. So walk me through an example of something you would find in a genetic test that then tells you what you may or may not process well as a food.
Mm-hmm. So the studies related to food are really kind of in two, maybe three broad areas. One is macronutrients, so protein, fat, and carbohydrates, and how well your body utilizes those. The second is micronutrients, so vitamins, the B6, B9, B12.
All the micronutrients.
So interestingly, there's only about 16 micronutrients that have definitive research showing that there is a genetic tendency. So those are the only 16 that we support. Obviously, there are a lot more than that, but we're following the science. And then the third on the nutrition side would be food sensitivity. So lactose intolerance, gluten sensitivity, things like that. So, the best example is really in the macronutrients where, if you are a poor fat utilizer, and if you have this specific genetic predisposition, then you are predisposed and you're very likely to not be able to process that fat just in your everyday diet. And so that can lead to weight gain if you're eating a diet that is too heavy in fat. So that's where we'll take, and in the report, we basically have a pie chart of, what percentages of each you should have, 25% healthy fats, 25% lean protein, 50% complex carbohydrates is kind of the standard and the base point. But we will shift those percentages based on your genetic predisposition. And then same thing with micronutrients. If you're genetically predisposed to being low in folate, then we're going to recommend you eat more foods that are rich in folate or potentially even take a high-grade supplement. So the recommendations are very straightforward. The science behind them is very complex, but we've written the content in our reports. This is one benefit of starting out as a direct-to-consumer company is that our reports were not made for specifically or for practitioners only, right? It's not like a LabCorp blood test report where you get, the reference ranges and it looks like Greek. Our reports were written at a 9th grade reading level and they were written with the client in mind. So, we do a really good job of making complex information simple to understand and to incorporate the recommendations into lifestyle.
Yeah, I go nuts when I see my blood test reports. It's like, this is so unintelligible. Why the heck are they doing this?
Right. And they were designed for doctors.
Yeah. It's really frustrating because I'm the one paying for it. It ought to be readable by me.
Right.
And so I spend a lot of time with the web,
yes,
looking stuff up, trying to figure out what the heck it means.
Exactly.
So as we think through the testing, it seems like this is something that, I don't understand why all of us wouldn't want this. You're not even trying to sell me, and I'm sitting here thinking, how can I get one of these guys? Because I'm keenly interested in the information, and I'm keenly interested in having others have access to it who would like it and who can afford it. It shouldn't be a cost issue, unfortunately. I'm not one of the people who thinks that the Constitution includes a right to health care, but I am somebody who thinks that we all ought to have an opportunity equally for health care, and that we ought to be doing things the best we can as a society and as an industry to provide those services to individuals, as comprehensively as possible. So I guess as I'm looking at the information and considering our conversation, the thing that I'm taking away from it is you've done a great job of busting a few myths for everybody. You've done a great job of creating a very intensely science-based platform for people to find out answers to either why they're not meeting their goals or why it's hard to meet their goals. You've created a view towards how to get plans put in place where they can be more successful in reaching their goals. And that the implications for this are not just, narcissistic. It's not just about looking good and performing well for others to observe you performing well, but it's also about internally feeling good about your own functionality. I mean, I like to say we want a quality of life curve that goes like this, right? Where you enjoy a high quality of life until you don't. And that's a precipitous fall, because we don't want to have, 10 years of suffering or 20 years of suffering, because that's just not a pleasant way to live. So I think what I'm hearing you say is that your offering really provides a platform for all of that understanding. Please correct me if I'm wrong, but I think that's correct, isn't it?
Yeah, absolutely. And in terms of the cost barrier and insurance in the United States, I do believe that definitely within 5 years, programs like ours will be covered through Medicare, Medicaid, and private insurance. Just because it's more and more research is being published every year. We'll get around to doing it ourselves too, but it absolutely is more effective. And there are studies out there.
I'm sorry, Scott, you're going in and out there.
Oh, sorry about that. I was just saying that there are studies out there that do prove that a person on a genetics-based, following genetics-based recommendations for diet and exercise is more effective. They're going to lose more weight, and they're going to have, less body fat, more muscle mass if they follow a genetics-based program than just a standard one-size-fits-all diet and exercise plan. So the research is out there. There's more coming out. I was just saying we'll get around to doing a study on our program specifically, hopefully in the next year or so. So I do think that within 5 years, it will be covered by insurance, and that's when it's really going to be open to the masses.
Well, what I really see you is, and again, perhaps wrongly, but I see what one of your distinctive characteristics as a company is the fact that you're an independent arbiter. You're independent of any particular program. You don't really care what the program is. You care about the goal of the patient, your client, and helping your client get there as successfully as possible, both efficiently and in terms of a steady, measured progress towards the end game, which is desirable. And you're not here to advocate a particular meal plan or a particular exercise program or a spa or whatever else. You're just here to get the patient to the place they want to be, which is optimized health. And my description of optimized health.
Yeah.
Which is, I think, hugely valuable and seldom found in today's market. I think so many people are so anchored to their preconceptions. They're not willing to do the homework and learn about other things, which may be better solutions to the problems that either they or their clients are experiencing. And so this is tremendously helpful and a breath of fresh air. So on behalf of the industry, I'm grateful. So Scott, I want to kind of wrap it up here, but thank you so much for this very thoughtful discussion. It really has been helpful. I did some research before we started talking today, and I think you filled in a lot of gaps in my own understanding. But I'm very confident that the audience will find the same thing. When we will put the notes down below, and so that everybody can find how to reach you and find out where their affiliates are. But I really want to thank you for spending some time with me today, and I'd like to invite you back so we can learn more, perhaps in a month or two.
Sounds great. Thank you for the opportunity. I really appreciate it.